I'm Bethany Williams. This is my physical assessment midterm check-off video. Hi Kay, my name is Bethany. I'll be your nurse today. We're going to do a physical assessment, so I'm going to ask you some questions and do some inspection of your body. It should take about 15 to 20 minutes, okay? So let me provide for privacy and go ahead and wash my hands. Okay, we're going to kind of go top down, so I'm going to start with just inspecting. It looks like your skin is pretty clear. Have you had any issues with skin? Okay. I'm going to go and look at your hair.
It's a little fucked up.
It's okay. Okay. Your hair looks nice. Have you had any issues with your scalp or dryness? Okay. Your head is symmetrical. It's in the midline position. I'm going to touch your scalp. Palpating your scalp for any bumps or bruises or anything that's tender. Have you had any issues with hair loss at all? Okay. I'm just going to feel on your side of your face for your temporal arteries. You can feel your pulsation. And the lymph nodes, they run along your face here. So first start with sinuses and then do your lymph nodes. Here's your frontal sinuses, your sigmoid and ethmoid sinuses, and your maxillary. Okay. Have you had any issue with sinuses or draining? Okay. Now the lymph nodes are on the inside and the outside of your ears. So I'll start right here with interior occipital, ocular, and then posterior. And then on the ones on the back side, I'll be going around, okay? This is where your occipital lymph nodes are, on the back. The tonsillar, right near your neck. And submandible and submental right here on each. We've got anterior cervical, the run in a chain, and posterior cervical. It's supraclavicular. Okay, I'm going to put my hands about below your ears and just feel your jaw opening and tightening. Okay, could you clench your jaw, please? Okay, now open your mouth. Okay, have you had any issues with pain in your jaw? Okay. We're going to go over some cranial nerves. So, can you raise your eyebrows? Okay, and lower your eyebrows. And smile. And do like whistling with your lips. Can you puff your cheeks? Can you raise your shoulders? All your cranial nerves look good. Okay. I'm going to be looking at your ears now. Okay? Get my inspection tool. Okay. Okay, I see your tympanic membrane is moist and intact and gray in color, with the cone of light on the right ear being at 5 o'clock and the cone of light on the left ear being at 7. So before I continue on to your eyes, I'm just going to make sure that you have proper sensation in your face. So just tell me if you can feel this.
Cheek. Right cheek. Chin.
And
Nose.
okay, all your sensations seem to be intact. So I'm going to move on to some various tests with your eyes, okay? Testing your vision fields. First thing I'm going to do is use my ophthalmoscope and look into the center of your eye, okay? Okay, I am seeing a full orange sunset. And the right eye looks good as well. I'm going to be touching your eyes and just looking at the white parts. Your sclera looks red and pink, and your conjunctiva is white, no redness. Okay, this is used for your field of vision. So we'll be testing your peripherals on each side, as well as how far away you can see, and whether or not your pupils dilate together or contract together. Okay. So the first thing I'll try is your range of motion of your eye muscles. Okay. So just follow the tip of the pen. Good job. Now I'm going to go behind you and test your peripheral vision, okay? Just look straight ahead and cover your right eye with your hand. Okay. I'm going to be coming with my fingers on the left side. Just tell me when you see my fingers.
No.
Okay? And we're going to do the same thing with the other eye.
No.
Okay? If you could look directly at me and tell me when you see my fingers.
Oh, coming up.
Yeah, coming up from the bottom.
No.
Okay. Now you're very tall, so I'm going to try this from the top.
No.
Okay. Peripheral vision. We've done the wagon wheel. I'm going to use the pen light now to come from the side. So you just look straight forward with your eye. I'm going to look at your pupil restriction. Okay? This is to test your vision. Your equal pupil constriction, and what your eyes are doing that. So that's good. Okay, so I'm just going to use this little flashcard I have. We're going to test your vision. So if you could cover your right eye, okay, and read the lowest line that you can see.
A, B, C, D, E.
Okay, and do the opposite with the other eye.
A, B, C, D, E.
Okay, thank you. Okay. Have you had any issues with the loss of your eyelashes or any facial hair at all? Okay. Do you have an occurrence of extra facial hair? I'm going to start inspecting your nose now, okay? So if you could just tilt your head backwards. This is just a pen light. I'm looking at inside of your nostrils. You don't have any history of deviated septum? No? Okay. Any history of nosebleeds? Okay. Okay, moving on to the next system, we're going to inspect the inside of your mouth. So all you have to do is open your mouth, and I'll just look around. Okay. Could you say ah? All right. Not seeing any abnormalities there. I've inspected the inside of his mouth and his lips for any issues with his tongue or teeth. Can you stick your tongue out for me? Okay, it's going at midline. That's good. So moving down from your head, we're going to do your neck now. Okay. So have you had any issues with the skin on your neck at all? Any soreness or tenderness anywhere?
No.
Okay, so you're going to feel me palpating your trachea. All right, it's center, midline, non-tender. Okay, I'm going to go behind you so that I can palpate your thyroid gland. Just look forward. Could you swallow for me? Okay. I'm going to be touching right here testing for tactile firmitus. It kind of feels like Rice Krispies under your skin. Everything is coming symmetrical. Okay, I'm going to start by listening to your lungs now. I will be going on the front side of your chest and on the back side of your chest. Before I move on to your lungs, I actually want to listen to your throat for one more time, okay? So using the bell with the stethoscope, I'll be listening to your carotid arteries and for bruise, okay? I don't hear any brewing, and they both sound strong on both sides. Okay, now we're listening to the lung sounds. Or, I'm sorry, I'll start with heart. So at the second intercostal space here, and again on the left side. Intercostal space. 4. And on this side here, there's the apical pulse. I'm going to listen to this for 1 full minute. Okay. I'm going to go behind you now. Okay, so you can just take a deep breath for me. Okay, you have symmetrical breath movements in your back. You're going to be listening to your lungs. Deep breath. Okay, could you say the numbers 99?
99.
Again?
99.
One more time.
99.
Okay. Would you say the number or the letter E?
E.
Say the letter E.
E.
Say the letter E.
E.
Okay. So the core coughing is showing up within normal limits. If I could, I'm going to get you to lay down. Please. Okay. I'm just going to be doing another form of listening to your lungs and heart rate on this side, okay?
Okay.
Aortic, pulmonic, verbs, tricuspid, and mitral. Can I get you to turn towards me? Just if you can. It's uncomfortable. Just take a moment. Okay. And with the bell part of the stethoscope, I'm listening for any heart murmurs. I'm not hearing you. Okay, thank you. One more thing before you sit back up. I'm going to be listening to your aortic artery down the center of your body. So if I can hear brewing, okay? Just stay laying for just a moment. I'm going to go back around to the other side. I'm now going to be listening to your abdominal cavity, okay?
Okay.
The right lower quadrant first. Normal active. Right upper quadrant. Normal active. Left upper quadrant. Normal active. Left lower quadrant. Normal active. Okay, I'm going to palpate. Just a moment. And percuss, so it's just, you're just going to feel me touching you, okay?
Okay.
I'm not able to feel an enlarged liver. And not able to feel the spleen at all. Do you have any tenderness anywhere?
No.
Okay. And I'm not going to be doing deep palpation. I would also be doing auscultation of the bruits for the femoral arteries. Okay, I don't hear any other abnormal sounds, so you can go ahead and sit up. That's all I'm doing for you today.